When we think of the passing of elderly loved ones, the first thought often centers around an unexpected event or sudden loss. However, the truth about death and old age is far more nuanced. In fact, the body often provides subtle but telling signals months or even a year in advance, allowing family members to prepare for the eventual end. This video will delve into 5 key signs that can indicate an elderly person is approaching the end of their life. These signs can sometimes be so subtle that they may seem inconsequential at first. Some may appear as simple aspects of aging, and families may dismiss them. However, these signs often signal something much more profound. Recognizing these changes early can help families provide better care, improve the quality of life for their loved ones, and make the most of the precious time that remains. Let's take a closer look at each of these signs and explore how understanding them can lead to a more meaningful and compassionate approach to the final stages of life. Unexplained weight loss is often one of the most obvious and early signs that an elderly person may be nearing the end of their life. The first signs of weight loss are often subtle. Perhaps a belt that suddenly fits a little looser or clothes that seem to hang a bit differently. You may initially dismiss this as an aging issue, something common that happens over time. However, when weight loss occurs without any effort to lose weight, it is often a critical sign that something more significant is taking place within the body. This unintentional weight loss is something that should not be overlooked. The process of weight loss in the elderly is often accompanied by a loss of muscle mass. As the body begins to weaken, muscle tissue shrinks, leading to a decline in physical strength. This can make it much harder for the person to perform even basic tasks. Tasks that once seemed easy, like standing up from a chair, walking around the house, or carrying groceries, now become exhausting. Weakness increases the person's vulnerability to falls and fractures, as the muscles that once supported their body are no longer as effective. Additionally, the immune system weakens as the body's energy stores decrease. This makes the person more susceptible to infections. A diminished immune response can make even mild illnesses more dangerous. Furthermore, weight loss is often accompanied by a reduction in appetite. Many elderly people lose interest in eating for a variety of reasons. Their sense of taste declines, making food less enjoyable. Eating becomes more of a chore rather than something they look forward to. This is particularly true when the body's energy needs diminish and hunger is no longer felt as strongly. The loss of appetite and the inability to maintain proper nutrition are not simply a sign of preference. They are often indications that the body is beginning to prepare for the end. It is essential to understand that weight loss in this context is not just about food. It's a result of the body's natural processes slowing down. Chronic illnesses such as cancer, heart disease, kidney failure, or even diabetes can significantly contribute to weight loss. These conditions might develop gradually over time, making them harder to detect until they have significantly affected the person's health. Even mental health conditions, such as depression, can contribute to weight loss. Depression, anxiety, or cognitive decline can reduce the individual's desire to eat, even if their physical health is still relatively stable. In this stage, families often try to encourage the person to eat more, offering their favorite foods or supplementing meals with high-protein drinks. While these efforts are well-intentioned, they are often not enough to stop the weight loss from continuing. The focus at this stage should be on comfort, offering smaller, easier-to-eat meals that are gentle on the stomach. At this point, it becomes essential to realize that weight loss is not just a symptom of poor diet. It is the body's way of signaling that it is no longer functioning as it once did. In these cases, forcing large meals or trying to increase calorie intake is unlikely to stop the weight loss. Instead, the focus should shift to offering comfort and ease. Soft, easy-to-digest foods like soups, smoothies, or nutrient-rich shakes can be a better option for maintaining energy levels. Hydration is critical at this stage as well. 2. Extreme fatigue and weakness are another clear sign that a person may be approaching the final stages of life. This type of exhaustion is far more profound than simply being tired after a long day or a busy week. It's a deep and pervasive tiredness that doesn't improve with rest. The person may experience fatigue, even after long periods of sleep, and this exhaustion may continue throughout the day. Tasks that were once easy, like walking, getting out of bed, or performing simple activities around the house, may now feel overwhelming. This type of fatigue is often caused by the body's gradual slowdown as organs begin to weaken. As the body begins to shut down, energy is redirected from physical activity toward basic survival functions. The heart does not pump blood as effectively, and circulation weakens. This means that muscles, organs, and tissues do not receive the oxygen and nutrients they need to function at full capacity. As a result, overall strength and stamina decline. At this stage, people often feel incredibly weak and unable to perform their usual daily activities, leading to a complete loss of their previous energy levels. This loss of energy can be incredibly frustrating for the elderly, especially for those who were once very active and independent. They may feel discouraged or upset by their inability to do what they once could, and this can also lead to emotional distress. Many elderly people take pride in their independence, and the decline in strength can be emotionally painful. As their physical abilities decrease, they may begin to withdraw from social interactions, activities, and hobbies, further compounding their sense of isolation and frustration. For families, witnessing a loved one who was once active and independent become so fatigued can be emotionally devastating. It can feel as though they are losing the person before they are physically gone. However, this decline is not a sign that the person no longer wants to engage with others. It's simply the result of their body's natural processes. Pushing them to do more or encouraging them to engage when they are too tired can worsen the situation. The best approach is to allow the person to rest when needed, supporting them in a way that is gentle and compassionate. At this stage, emotional support becomes just as important as physical care. By offering comfort, allowing the person to rest, and understanding their limits, families can make the last months more comfortable. Instead of focusing on trying to make them more active or pushing them to engage in activities they can no longer handle, the focus should shift to providing emotional and physical comfort, listening to them, offering reassurance, and creating a calm and peaceful environment will help them through this transition with dignity and grace. 3. Cognitive decline and emotional withdrawal. Cognitive decline is often a very noticeable sign that someone is nearing the end of their life. At first, this may manifest as small memory lapses. The person may forget where they put things, forget to take medications, or misplace keys or other familiar items. These early signs are easy to dismiss as normal forgetfulness or part of the aging process. However, as time passes, these lapses become more pronounced and frequent, and the individual may have difficulty recognizing family members, friends, or familiar surroundings. The cognitive decline that occurs in elderly individuals is often due to reduced blood flow and oxygen to the brain. As the body's systems begin to slow down, the brain becomes less effective in processing information. Memory loss becomes more severe, and simple tasks like following a conversation or recalling a name may become increasingly difficult. This change in cognitive function can be particularly difficult for families to witness, especially if the individual was once very sharp and engaged in daily life. Along with cognitive decline, emotional withdrawal is often a common sign of someone nearing the end of life. People who were once outgoing, social, and active in their communities may begin to lose interest in interacting with others. This is not a reflection of their feelings towards others, but rather a result of the brain's diminishing ability to process emotions and interact with the world in the same way. Overstimulating environments may become overwhelming, and the individual may retreat into themselves, spending long periods alone or in silence. This emotional withdrawal can be especially painful for family members, who may feel as though they are losing their loved one long before they pass away. It can be heartbreaking to see someone you love retreat from social interactions, family events, and meaningful conversations. However, it's essential to understand that this withdrawal is often an unavoidable part of the decline. A person to engage in conversations or participate in activities they no longer enjoy will likely cause more frustration and distress. Instead of attempting to bring the person back into social situations, it is often more effective to meet them where they are emotionally, speak gently, and offer them comfort in ways that don't require them to engage in long conversations or complex activities. Even sitting with them in silence or offering quiet companionship can be a great source of comfort. This stage is about emotional presence, letting them know that they are loved and supported, even if they can no longer express it in the same way. 4. Increased frequency of infections and slow healing. An increased frequency of infections is another sign that the body is weakening. Common ailments like the flu, colds, or even minor cuts and bruises may become more serious and take much longer to heal. As the immune system becomes less effective, the body struggles to fight off infections. Even small injuries can lead to complications because the body's ability to repair itself is no longer functioning at full capacity. This process of slow healing and recurrent infections is a clear indication of the body's declining health. The body's immune system is designed to fight off infections and heal wounds. However, as a person approaches the final stages of life, this system weakens, and the body becomes much more susceptible to illnesses. It can be concerning for families to see their loved one develop frequent infections that don't seem to resolve. Even antibiotics, which would normally be effective in treating infections, may not have the same impact. Recovery from illnesses becomes slow, and what would have once been a mild illness can now become a serious issue. Bed sores or pressure ulcers are another major risk for people who are immobile. If the person is bedridden or confined to a chair, pressure from their body weight can cut off circulation to the skin, causing sores to develop. These sores can quickly become infected and lead to even more significant health problems. As the body's ability to fight infection decreases, these sores become much harder to heal and can lead to serious complications. It's important to keep the skin clean, hydrated, and moisturized to prevent pressure sores from developing. As the body weakens, medical treatments may not work as effectively. It may become clear that further aggressive treatments or hospitalizations may not significantly improve the person's condition. At this point, the focus should shift from curing infections to providing comfort. Hydration, pain relief, and gentle care will help the person feel as comfortable as possible. Families should focus on providing a peaceful and supportive environment that prioritizes their loved ones' well-being over attempting to fix every illness. 5. Changes in breathing patterns and circulation. One of the most evident signs that someone is nearing the end of their life is a noticeable change in breathing patterns and circulation. The person's breathing may become shallow, slow, and irregular. There may be moments when they struggle to breathe, or their breaths may become more labored. This change is often a result of the body slowing down its functions and preparing for the final stages. In some cases, the person may experience Cheyne-Stokes respiration, which is characterized by a pattern of rapid breathing followed by long pauses. As breathing becomes more irregular, the circulation system also begins to slow down. You may notice that the person's hands, feet, and face become cold to the touch. The skin may appear pale or take on a bluish tint, particularly around the extremities. This occurs because the body is prioritizing blood flow to vital organs and reducing circulation to less critical areas, such as the hands and feet. The person may also experience shortness of breath with minimal activity, even with simple actions like sitting up or talking. For families, watching a loved one go through these changes can be frightening. It's natural to want to intervene or help, but it's important to understand that these changes are a normal part of the process. Rather than focusing on trying to fix the person's breathing or circulation, the goal should be to make them as comfortable as possible. Offering small sips of water, adjusting their position to make breathing easier, and ensuring that the environment remains cool and calm can help alleviate discomfort. In conclusion, recognizing the 5 key signs: unexplained weight loss, extreme fatigue, cognitive decline, increased infections, and changes in breathing and circulation can help families provide better care for their loved ones. Understanding these signs early on allows you to prepare emotionally and practically for the inevitable. It provides the opportunity to shift the focus from fear and anxiety to offering love, support, and comfort during the final months of life. While these signs can be difficult to witness, they are an important part of the dying process. Understanding them helps you provide compassionate care, ensuring your loved one is as comfortable as possible. Instead of focusing on trying to stop the inevitable, you can focus on making the final stage of their life filled with peace, love, and comfort. Recognizing these signs gives families the ability to prepare and respond with clarity, compassion, and understanding. Thank you for watching today's video. We hope this information has been helpful in understanding some of the key signs that appear in the final stages of life. Recognizing these changes early can help you provide the best possible care for your loved one, while also preparing emotionally for what lies ahead. Please share your thoughts and experiences in the comment section below. If you found this video valuable, please like, share, and subscribe to help us continue producing content that supports families going through similar experiences. Your support means a great deal to us, and by sharing this video, you help us reach more people who may benefit from this information. We hope this video has provided the guidance and insight needed to navigate this challenging phase with empathy, patience, and peace. Take care, and we look forward to seeing you in our next video. Thank you for being part of this community.